Picking hyperprolactinemia, which is one condition that could actually be implicated in what? Prolactin. So if prolactin levels are too high, you say you have what? Hyperprolactinemia. Anemia is something that is present in the blood. Hyper is high. Prolactin is prolactin. Combining everything we heard, you will say that what? Hyperprolactinemia just simply means prolactin levels in the blood are too high. So it's just a condition where the body produces what? Too much prolactin. Prolactin is a hormone. It's primarily responsible for what? Milk production and breast development. So while elevated levels of prolactin is normal during pregnancy and breastfeeding, high levels outside pregnancy and breastfeeding shows that there's a problem. Alright, so what are the common problems that if you see prolactin levels in somebody that is not pregnant, somebody that's not breastfeeding, what are the possible things you might be suspecting? So you can be suspecting prolactinomas, which are benign tumors in the pituitary gland. They secrete prolactin. It can be as a result of side effects of some drugs like antipsychotics, antidepressants. It could be health conditions like what? Hypothyroidism, polycystic ovarian syndrome, chronic kidney disease, chronic liver disease, chest wall injuries, shingles. Sometimes the cause is not clear, so it's idiopathic. But just know that if it is in a woman, if prolactin levels are so high, breast milk will be discharging. So in women, it will cause them irregular or absent periods. It can cause infertility, galactorrhea, right? The milk is discharging. It can cause their vagina to be so dry. That's why, like a woman that just recently gave birth, she could hardly conceive. She's not really interested in what? Sex. That's a low libido that comes with high levels of prolactin. For men, it causes what? Erectile dysfunction, low testosterone, enlarged breast tissues. So if you find a man having like breasts trying to like get big like that of a woman, okay? So in both sexes, it causes headache, vision changes, bone loss, okay, and all of that. So diagnosis, they can do blood tests to check for prolactin levels, right? They can do MRI scan, that's a magnetic resonance imaging, to check the pituitary gland in your head to see if it is actually what? There's a tumor there. You can do thyroid function tests, medication review to identify if it is a drug that the patient is taking that is actually causing it. So treatments, you can do drugs like what? Bromocriptine, carbagoline. They can do surgeries if it's a tumor. They can do radiotherapy too if it's a tumor. Then thyroid hormone replacement therapy. So sometimes prolactinemia could be coming in, and one of the side effects is what? The thyroid hormone is little, so you replace thyroid hormone. Okay, so that does it. If it's a drug causing it, you stop the drug.